Today I'm going to tell y'all how to pass NCLEX on your first try in 85 questions. Hey, I'm a nurse. I graduated May 3rd, took the NCLEX June 3rd of this year, and got my results the next day. I passed in 85 questions, and it took me about 2 hours. I took the NCLEX Next Gen Generation RN licensure test, and you can pass in as little as 85 questions, or you can get the full 150. It is a computer adaptive test required for nursing graduates to successfully pass to be licensed as registered nurses in the US and Canada. You will find case studies on there, bow tie questions, select all that apply, and multiple choice. You have up to 5 hours to take this test in one sitting, which includes breaks. And I'm going to tell you what I did to pass the NCLEX in 85 questions on my first try. I started studying a month or two before I even took the NCLEX, and I did not use UWorld. I used Archer. And the thing about Archer is that their tests look exactly alike to the actual NCLEX. The way the format is set up, the adaptive testing and quizzing, everything is the exact same. When you get the Archer NCLEX plan, you're going to take one test a week, depending on how soon or how far away your test is. You can start off taking it one test a week, two tests a week, and then a week before the test or 2 weeks before the test, you may want to take it every single day. Archer will give you rationales. You're going to want to go over all the rationales and write them down. They're also going to tell you where you are taking the test. Like, are you borderline? Are you likely to pass? Are you very likely to pass? Or are you unlikely to pass? I would get, my first test, I got borderline. And then everything after that, I got very likely to pass. It will also tell you what categories you need to study more in, whether it's adult health, pediatrics, mental health. So you can just take mini tests in that category. You also would like to get a physical study guide that you can refer back to on the questions that you got wrong. Like, let's say you got asthma wrong and you need some more help with asthma. Look at that study guide and see what the interventions are. See what the diagnosis is, what the treatment is, what the assessment is, because the NCLEX is a big safety test. They're not just going to ask you about asthma, like what it looks like. They're going to ask you how to treat it. What's going to be the emergency diagnosis of asthma, which is status asthmaticus, and what can you do to save that patient's life. It's a big safety test. And honestly, everything you learn through nursing school should get you through this test, because like I said, it's a safety test, and really no amount of studying is going to prepare you as much as what you are already prepared for. So my biggest thing is Archer and study guide, and just go over things that you're having trouble with, and take the practice test because they're similar.